Hello, Holistretch fam. Welcome to a Holistretch video. My name is Frances Eve. In this video, I'll be showing you how to release your client's low back. Please subscribe to the channel if you haven't yet already for more assisted stretch videos. And let's begin. We will start with a palpation, so feeling up and down the spine and then releasing any areas of fascia that is dense. So with my client here, I noticed that alongside his spine on the upper back, it just felt very, very tight. And oftentimes we have to release the upper back in order to even get to the low back. Because the low back is very sensitive, it's good to work on the upper back first so that all of it is released before we get to that part. So right now we're going to isolate that shoulder. We go ahead and pull it gently from the inside, and then you can perch your knee on the table to rest it on top. This is a great way to open up their shoulder while their shoulder is still relaxed. I do work with a lot of clients with shoulder injuries or tension in their shoulders, and this position is always relaxing for them and doesn't cause any issue. So this is a great way to get into the anterior delt as we curl our fingers underneath that shoulder area and gently pull back using your body weight. When we pull back the shoulder, we release the trap away from the ear. Bringing the hand to their side, we can scooch our hand underneath the inside, making sure to keep your body with a straight spine as not to hurt your own back. We always want to make sure our body mechanics are even, balanced. And we can take our other hand and palpate into the trap, gently pressing in, releasing the soft tissue. We're going to move on to the other side, doing the same thing, feeling around where there's any dense fascia. And in this case, I noticed a similar density on the other side of his back and his left shoulder as well. So we're just going to work the same way on the left shoulder. Swinging that elbow out from underneath on the left side, perching that knee up on the table and swooping it on top. We can take the fingertips and curl them underneath the anterior delt to pull back, using our body weight to create pressure, releasing the shoulder away from the ear. A lot of people with tension in their backs often have tension in the traps, and that can be caused by stress or fear or anger. Any of those things can cause those issues. And so this is a great way to release. Bringing the elbow up, we can get a different angle and release the low back from the mid upper back, and then bringing the hand to the side, sliding that hand underneath their shoulder once again, maintaining your proper body mechanics, and continuing to do some soft tissue release. Bringing the other hand on top. If you can go ahead and separate that fascia away from the scapula and then back towards it, so you're really releasing the trap. And then bringing that arm back. We're going to go ahead and have the client lay on their back now that their upper back is relaxed, their mid back is relaxed. We have space, we can work on the low back, okay? So in areas of sensitivity, it's always nice to work on the surrounding muscle tissue to create space. We'll go ahead and start by doing a little hamstring stretch on the left side. Hamstrings, of course, are connected with the glutes and can cause pulling on that sacrum and on the low back. So it's really great to open up the hamstrings first. We're going to bring their foot to our shoulder, our anterior delt, and then bringing the body weight down to give them a nice stretch. Letting that knee slide over to the side, we can bring their foot to our hip flexor and using our hip to create a stretch for them. This is a great resistance stretch, so having your client gently extend their leg out towards you, and then you can push forward, creating that openness in the adductor and the groin. Always making sure that your spine is in alignment such that you don't pull anything in your own body and you create a nice even resistance for your client. We'll go ahead and bring the hands to the top of their knee now and using your body weight to pull back. This is a great opening for their hip flexor. It helps release any pressure out of their psoas. Next, in order to open up the psoas more deeply, we're going to have them squeeze their knee up towards their shoulder and then pulling the knee downwards. As they're pulling up towards their shoulder, they're contracting that hip flexor, and as you're pulling down, you're straightening it out, stretching it out. This is one of his favorites because it really gets so deep and opens up that coccyx to make space for the low back. We're going to go ahead and cross the right leg over the left, grasping onto the left ankle. We can go ahead and bring the other hand to the psoas and lean our body weight back. As you can see, this really opens up that hip for them. This is really, really amazing. You can create depth in the stretch by pressing into their psoas muscle. Taking some nice breaths and returning back. We'll go ahead and move on to the other side. So taking their other leg now, we're going to move into that hamstring stretch. We can create some movement there in the hip. And bringing the foot to the shoulder, leaning our body weight in to give them the full hamstring stretch. Having them extend the leg gives them resistance as you push their knee back towards their chest. This resistance can deeply open the hamstring and then allowing that knee to fall open to the side. We'll open up the hip flexor even more. And I like to keep the integrity of the stretch by pushing their opposite leg, making sure that it stays flat. Taking that foot, bringing it to the hip flexor, you can bring your body weight forward, allowing them to contract the muscle, and then having them extend out. So we do go one way, right? We're opening the groin, the adductors in here. And then next we go the opposite way. So remember when they're having the knee pull in towards their shoulder and we pull back, oftentimes it's great to go both ways on the stretch. So you're strengthening one side of the muscle and lengthening the other, and then vice versa. All right, and we'll go ahead and have them squeeze the knee up to their shoulder now, and we pull down. So I bring my hand to their heel of the foot, and then one to protect the knee, and then pull down. This really creates this long line of stretch all the way from the top of the psoas all the way down to the foot. This helps to release that low spine, the back, the coccyx, straightening everything out in the hips. It's really quite amazing. And then we'll take that right leg underneath, draw it under the left, press the hand onto the psoas, and pull the body back. Take some nice breaths in here, and then return back. Next, we're going to move on to the other side. We're going to work into their hip. Releasing the hip can create so much release in the low back. So we're going to go ahead and take their knee, their left knee, and bring it on top of yours, so they're in a figure 4 position. And we'll make some circular motions just to feel around where you feel the most tension and start to loosen this area up. You see how his hips begin to release and soften. Next, we'll go ahead and have them press their knee into you as you bring your body weight forward. The beauty of resistance stretching is that tension, that toning of the muscle, and then the softening and the releasing. We have a beautiful balance of both feminine and masculine essence in these stretches. To bring them into a figure 4 position, you can go ahead and grab their opposite leg while you rest their foot on top of their knee. This helps to put them in a figure 4 posture without them having to do any work. So this is a really nice and gentle way to help them stretch their hips. A little rocking here can help with the low back, releasing and opening and softening. And then we'll come back down. We'll do one final stretch on this side by bringing the left leg all the way across the body, the right leg over, and then you can bring their left leg to your hip and slide your arm underneath the top leg to open them up. You'll see a little better on the other side, but this is a really, really deep opening, really deep stretch for their entire side body. Sometimes I suggest them holding on to their wrist to open up the upper body as well. Moving on to the other side, we'll go ahead and start with that hip opening by resting their foot on top of your knee and using your body as a mechanism to push forward. Remember, for the safety of your own body, it's always important to use your entire body weight as opposed to muscling it with your biceps. And have them push into you with resistance and then come back forward. So the resistance is that they push into you, and as you begin to push into them, they gently and slowly release. So it is sort of like a seesaw movement where one person is pushing and the other one's releasing, but there is always resistance on both ends. This is what creates the integrity of the stretch. Coming into that figure 4, bringing the foot on top of the knee and bringing their opposite foot to your shoulder and leaning forward. And gently release on the breath and bringing the foot all the way over to the other side, just like we did before. You're bringing that foot to the outside of your hip, sliding the hand underneath to guide that leg over to the side. And when you are complete, your client should be feeling much better. Thank you so much for watching this video. I'll see you in the next one. Feel free, everyone. Take care.